Hello and welcome to everyone who is joining us today for Wednesdays at noon. Today is an extremely special episode for us. We have emergency medical physician Megan Kwasniak, who is joining us, and she actually is on the front lines of the current pandemic. And today she will speak to us about her experience and also answer a lot of questions that everyone in the world might have, and also that we curated for her to answer. So thank you so much to everyone who is joining us. And with that, I want to take the time to thank frontline workers. Specifically to you, Megan, thank you so much for joining us and to make time to do this. This is extremely important for our community and for just everyone who might have anxiety around COVID and just need a safe space to have their questions answered. And thank you to every single frontline worker, whether you wear a uniform or not. We see you, we respect you, and we thank you for all of your hard work and allowing us to be able to stay home and be safe and putting your lives on the line every single day. So thank you to every single frontline worker out there worldwide.
Thank you so
I
much.
also want to take this time to let you guys know that this conversation will be ASL interpreted, so you can find it on our page in a couple days with ASL interpretation for anyone who might need that accommodation. And I'm so happy to be here, so we can go right into it. Megan, if you want to take this time to introduce yourself and let people know who are you and what do you do.
Thank you, Shanique, for the intro. My name is Megan Kwasniak. I am an ER physician. I currently work in West Palm Beach, Florida. I trained in Brooklyn, New York. So Brooklyn's very dear to me. And I'm here pretty much right now to answer any of your questions.
I love that. Again, thank you so much for taking this time out to be with us. It means a lot to us. So the first question would be, is it safe to go to a hospital or a doctor's office right now?
So this is a very important question to ask. I believe there's been a trend where people are just a little bit concerned about going for checkups, going to address their slightly less emergent needs. But I must say that it's definitely safe to go to the hospital or a doctor's office if you are feeling sick, if your child is feeling sick, if anyone is not doing well, then definitely it is a good time to go check yourself out. You know, a lot of the outpatient clinics and offices, doctors' offices, have been taking necessary precautions to ensure patient safety. They have sanitizing measures in place. The staff wears masks, obviously gloves. There's masks available for patients and their families. So it's definitely, safe and important to go if you feel that you have symptoms prompting you that you need a medical attention.
Thank you so much for that answer. And it really eases my anxiety as a civilian, as a person who is a little worried about going to the hospital right now, just because it is kind of like the mecca for disease in a way. Like everything kind of lives there. So I was a little worried about that as an adult and also for children. So thank you so much for answering that and for
Absolutely. And I will add one more thing to that, especially for hospitals, like emergency room settings. Certain measures are in place in most ERs where there is an initial screening in place. So if you're very worried, I may come in contact with a COVID patient at the hospital, be assured that there are certain screening measures that the emergency rooms take. So if somebody screens in for potential coronavirus infection, they are likely placed in a separate area in a room that's specifically designed for a disease like this. So you may actually not come into contact with it at all, which, it's also reassuring in a way.
Yes, thank you so much for that. Hi, My mom is watching, and also hi to Robin Waxenberg. She said, great insight about the doctor's office and hospital. I know people are putting off care for non-COVID issues, and it is a great reminder that we take care of our health. Yes, Robin, I agree with that. The next question is, could you tell us what PPE is? What does it mean? What is it? How does it work?
So PPE stands for personal protective equipment, and it is basically an outfit of sorts that is designed to protect healthcare workers caring for patients with infectious disease. Obviously, we've been using it a lot during the pandemic. We also use it when we face other infectious diseases like, potential tuberculosis, meningitis, all that stuff. But we have been using it a lot now, specifically because of Corona. There are different types of PPE. What you see on the screen right now is a photograph of myself. And it's just one form of PPE that we have been using. Different hospitals, different emergency rooms have different ones. So this is not the only one that you will ever see. But what I can show you is, if you look at the top, I am wearing some sort of head covering that would just kind of put my hair away, so my hair stays face in case there's any droplets that would land on my hair. There is a face shield that protects my eyes. You could also wear goggles with that, but sometimes the shield may be enough. I'm wearing, in this particular photograph, I'm actually wearing two masks. The one that you can't really see.
Lisa, can you make it big again, just for people who might? Thank you.
So there's actually two masks on my face. One is the one you can't really see that well, but it is the N95 mask. It is a mask specifically designed to prevent any kind of particles to enter my breathing area. On top of it, I'm wearing a surgical mask. Normally, you don't have to do that. We've been doing that a little more just to make sure we preserve the integrity of the N95 because we I am wearing a plastic gown. It's not an ideal size for me in this case. I just wear it for demonstration purposes because my neck is a little bit exposed. Ideally, my neck should not be exposed. The plastic covering is covering it too, but it should be, ideally should be fully covered. But the plastic gown also protects my clothes, my scrubs from getting contaminated. And I am wearing gloves. Usually we will wear 2 sets of gloves when we go into a room with a sick patient and remove one as needed. So that's pretty much it. You can see it here as well. I wasn't wearing it at that time, but there are shoe covers as well that we use. So essentially the PPE is designed to cover our scrubs and our bodies, our skin, our eyes, preventing us from getting in contact with any kind of droplets that may be coming from the patient.
So important. Could you tell us about this other picture that we have on the screen?
Sure. This is a picture of my dear colleague. She is one of our mid-level providers, and she's actually was working in the tent designed to take care of COVID patients. She is, as you can see, she has the head covering. She has the goggles. These are very, very good. They're protecting her eyes, and they kind of go over like this. And she is wearing a respirator. The respirators are wonderful. I have one as well. They are also meant to prevent any kind of particles from coming in contact with our mouth, with our nose, and they're multi-use. So we can use them up to 1 month, and then we can change the filters and continue using them. So we could really use these for a really long time, which is wonderful. You just disinfect it and use it again.
Right, love that. Okay, so the next question would be, are COVID and non-COVID patients separated, or can I get COVID-19 from visiting a hospital?
So this kind of goes back to the question that we mentioned before. Right. In most hospitals and most emergency rooms, the COVID patients get separate rooms. They get placed in separate areas. So the, so to speak, regular patients, very likely that they will not come into contact with COVID patient at all, because there's certain protocols in place. But I will say this, which will probably bring us to our following questions. No matter where you are right now, it is incredibly important to protect yourself.
Mm-hmm.
And there's never 100% guarantee about anything. Definitely will not happen. You never know, which is why taking necessary precautions is so important, like hand washing, wearing your mask. Even at the hospital, you try to just avoid getting too close to people, maintaining the social distancing. You'll likely, as a patient and a family member, will be given a mask to wear. So please keep that mask on at all times when you're in a hospital, and just be mindful of what you're doing, what you're touching, and where your hands go.
Right. Speaking of which, I don't know actually if that is later in our questions, but speaking of, actually, I'm not going to touch on that. I was going to ask you, could you tell people how to correctly wear a mask? But I think that is later in our questions. The next one is, what symptoms should we look out for?
So COVID-19 is an upper respiratory illness, and the more classic symptoms are fever, cough, runny nose, a headache, sore throat, kind of like the flu. Some of the things that we have seen commonly as well is extreme fatigue. Mm-hmm. So people may be just, feeling really run down and very tired. Some of the other things that have been showing up are diarrhea, maybe some belly ache, discomfort. More serious symptoms are things like shortness of breath, severe cough, tightness in the chest. These are all things that could potentially signify a COVID-19 infection.
I see. So the next question would be, when should someone go to the doctor or hospital? At what point would you suggest?
Most of the important factors to watch out for would be things like shortness of breath. Okay. If you get COVID and you just feel, having really hard time breathing, walking around is very difficult because of the shortness of breath, things like that, it's a good indicator to go to the hospital and get checked out. The other symptoms would be, if your diarrhea is very severe, if you're not holding any fluids down, things like that, that would also be a good time to go check yourself out. If your fever, persists for a really, really long time and you're just not getting better, that's also a good idea to go get yourself checked out. With COVID-19, we have seen that the symptoms are getting, lasting a bit longer than the flu. Sometimes the flu is 2-3 days, 4 days, you get over it. With COVID-19, we've seen people with symptoms as long as 2 weeks. That's typical, but can also be a worrisome sign of like a COVID-19 pneumonia or further complications. So definitely that would be the time to go to the hospital.
Someone asked, is it different with adults versus children for when we would get medical attention?
It's very similar. I believe, if you feel like your child is struggling to breathe, sometimes with children, they won't tell you. So that's a little bit of a challenge, but you can watch the breathing patterns. If you see that the child is breathing unusually fast, if they're struggling for breath, extreme fussiness, things like not eating for a prolonged period of time. Of course, when they're sick, they're less likely to eat, but they're not taking any fluids in. They don't want to drink anything. They're having a lot of diarrhea or vomiting. They just can't hold anything down. Then I would definitely bring them to the hospital.
And what happens when someone tests positive?
So this is, it depends very much on who you are as a patient, what your risk factors and comorbidities are, what your age is, and if you are able to quarantine or not. So the most important thing is to quarantine yourself for at least 14 days. That means, in extreme cases, lock yourself up in a room, try not to get in contact with anybody.
I
Obviously,
was actually just going to ask that. So I noticed that in certain situations, people may not have the privilege to be able to quarantine the way that they're technically supposed to. If it comes to that, what would you recommend?
Yes, this is a very important issue and a very important question. And obviously, ideally, you would want to be separate from family members for a period of 14 days. Mm-hmm. That means sleeping in a separate room, sleeping in a separate bed, and not really, obviously not touching, not hugging, no kissing, things like that. Maintaining 6 feet distance as much as possible. It's hard for me to say, what to do if you're living with multiple family members in a small space. I completely empathize, and it's a very difficult situation. If you have means to maybe go to another relative's house or a friend's house where they have, a much bigger space and you're not going to come into contact with them, that's preferable. Obviously, just do your best that you can. Wear a mask if you get a mask from the hospital or the stores or whatever, the pharmacy. Wear a mask. Constantly wash your hands. Try to keep a distance as much as possible from your family members to not expose them, not put them at risk, especially if there are elderly people living with you or young children with disabilities or whatever that may be. Very important to try to stay away from them as much as possible.
Can you tell us what comorbidities means? You said that earlier.
Yes. So comorbidity is any kind of illness, chronic illness that a person may have. For example, diabetes, high blood pressure, asthma, any kind of lung disease, respiratory disease. Some people unfortunately have things like trying to use layman terms, pulmonary fibrosis, just problems with their lungs are stiff, or they're smokers. They've been smoking for a very long time, and they have now developed asthma or bronchitis because of the smoking. They all increase the risk for getting COVID as well as getting a severe case of COVID. So if you're living with someone that has any of these diseases, cancer, anything at all, definitely most important thing would be to isolate that person from yourself.
And what happens if my child tests positive? This is something that I would imagine brings extreme, not only despair, but anxiety to parents. What happens if a child tests positive? Will parents be able to stay with their child?
Yes. So even though personally I don't see as many pediatric patients, I have reached out to some of my colleagues who are pediatricians in the ER and on the floors, and I've spoken with them and addressed this issue. So a couple of things I want to mention. Number one, the good news is that the children get sick much less at a lower frequency with COVID than adults, even up to this point, which has been very kind of reassuring. Not to say that they can't get it at all. There has been cases, but of most of the cases that have been diagnosed, the illness is mild and passes easily, and the child does not need hospitalization. Most, again, I'm sure there's been cases that kids have been hospitalized, but for the majority of the time, they actually do okay at home. So that's very good news. If the child does happen to be hospitalized, what I've been told from my colleagues in my hospital as well as other hospitals around the country, that a parent is allowed to stay with the child 24/7. They have to be with them in an isolation room. They have to wear a full PPE. So they minimize exposure to themselves but they have been able to stay with the sick child. So.
And the PPE will be given to them by the hospital, and it will look something like what you were wearing in the earlier.
Or maybe not the respirator kind, but the mask, maybe goggles, a gown, gloves, things like that.
Okay, and the next question would be, why do people need to wear masks? This is so important.
Right. So masks are there to protect you as an individual as well as others. A mask is sort of a barrier between your secretions, meaning, your saliva, things that may come from your lungs, from your nose, things like that. So it ideally should cover your nose and mouth. It's the best way to describe it is just like a physical barrier that, if you cough, it's not going to splatter everywhere. So the cloth, or, ideally, if it's like a surgical mask, is going to stop a lot of these particles from reaching the air and then landing somewhere on another person. So it's very important. And also it protects you. If you're around somebody who may have COVID and may be coughing or whatever, then it also, your nose, your mouth, which are the most important parts where the particles could enter, are protected and you don't get infected that way.
I noticed that you said over your nose and mouth. Can you please touch on that? Because I've seen people using it, maybe putting a mask under their nose and, different places. And it's like, no, you're completely defeating the purpose. So for someone out there who needs to know how to correctly put on and take off a mask, can you explain that to us?
Sure. So ideally, we don't want to touch the outside of the mask at any time. There's usually, like ear rubber bands or whatnot, or sometimes hide in the back too, which is fine. But ideally, you don't want to touch the outside of the mask at any point. Number one, not to contaminate it even before you put it on with something on your hands. And especially after you take it off, because there may be some particles that landed on the mask which protected you, but they are still on the outside. So, the virus can enter in a variety of ways, but it can, one way it could go through the mouth, through the nose, or through the eyes. So you definitely don't want your nose to be uncovered and just your mouth to be covered, because you're opening up a potential entryway of the virus into your passages. So you definitely want to cover the nose, you want to cover the eyes. And when you take the mask on and off, it's just kind of like this. You just kind of, you don't want to touch, ideally not the outside or the inside.
So a forward motion then, when they're taking it off. Try to keep it.
Depending on what the mask is, because there's different kinds. Sometimes, they're tied in the back, you just kind of untie and let it go, or you just this way.
So farthest away from your face, you would recommend taking it off. Okay, that's great. Thank you so much for clarifying that. Our next question is, let me go back to the question sheet. Why is not touching my face important? How does the virus spread if I touch my face?
So kind of similar ways that we just talked about, getting anywhere through these passages, the nose, the eyes, the mouth. And we all know that we carry lots of different viruses, bacteria on our hands throughout the day. Most of them never really infect us. They just don't. But with Corona, obviously, the virus being what it is, we have had an increased chance of infecting ourselves. So most important thing is hand washing. I cannot stress that enough. You think you wash your hands enough? Wash twice as much. Okay? Especially now, every time you leave, you go anywhere, you go to a store, get your groceries, whatever that may be, don't touch your face so you don't get in contact with the places we talked about. And when you get home, the first thing to do is to wash your hands, soap water, scrub them people have formulas, happy birthdays, this and that. I just say scrub really well for as long as you can, rinse the hands, let the water run this way, kind of like that. That helps it too. And then just, use a clean towel to dry the hands. And then your risk of getting coronavirus or any other disease for that matter is significantly decreased. So anytime you go out, you're doing anything that you feel, you might have even touched your car, you go get something from the car, whatever that may be, just wash your hands. If you think you're washing enough, you're probably not. Wash more.
Yes, I think that's so important. And also, I was wondering, this is a question that I have. Can the coronavirus be spread through shoes? So, like, should we be careful, like, not to wear our shoes, like, in the house? Is that something that we should worry about or no?
I always recommend that anyway, because there is a lot of stuff we drag into our homes. So I do recommend not wearing shoes at home. It's kind of like goes back to the issue, can coronavirus be found on surfaces? The shoe is a potential surface area, and yes, but the issue would be more, let's say, you had the virus on your shoes, you bend down to untie your shoes, all of a sudden, I have something on my face, I'm going to scratch my face. Now you just introduce the virus into your mouth or whatever.
Right.
So it kind of goes back. So let's say you don't take the shoes off, but I would still wash the hands right away. Like as soon as you enter the house, I would just wash your hands before you do anything else.
Thank you for that. Someone just asked, are you seeing fewer cases at your hospital right now?
Over the past couple of weeks, we have been seeing fewer cases, which makes us happy. We're glad that we're seeing fewer cases. Obviously, a lot of that probably has to do with the quarantine. There was pretty strict quarantine down here in South Florida. We have been reopening. It's going to be interesting to see what happens. Obviously, we're all praying that it's not going to get bad again, and then we just have to advise for precautions and pray for the best.
Yes, absolutely. Should people get tested for COVID-19 if they are not symptomatic?
Interesting question. I don't think it's necessary to get swabbed. If you don't have symptoms, you likely will not be COVID-19 positive. Could there be some asymptomatic carriers? Possibly. We're not sure if those people are necessarily infecting others. There is a test that your doctor or a clinic may order, and that's an antibody test. A test that basically checks if at any point you have been exposed to coronavirus, and if you didn't have symptoms or had mild symptoms.
I was just going to ask that. I keep hearing this word antibody. Can you tell us what it means? Like, we now know what the test is and what it finds, but what is an antibody for anyone who may not know?
Basically, antibody test checks for antibodies are particles, I'm not sure how to explain it, but agents in your body that are like immunity agents. So, you get exposed to an illness and your body says, we got to fight this off, because most of us have the intrinsic capability to fight off a lot of different infections. So your body encounters a virus or a bacteria and starts to develop antibody, which are like warriors that will fight the illness.
Absolutely.
So antibody testing for COVID-19 can test to see if you've been exposed and your body actually responded to it in a good way. And there's different kinds of antibodies. I'm not going to get into that. It gets a little complicated. But just know that you can get tested. You can ask your doctor to run the test. I know most of the doctors here in South Florida have the test available. I'm not sure, obviously state specific, but I believe it's pretty widespread right now. So just talk to your doctor. You
Mhm.
won't be able to get this test in the emergency room. It's not something you go to the ER for,
Mhm.
but an outpatient clinic, yes.
Mhm. And is it painful to get tested?
The antibody test is a blood test. There's two kinds. You could eat one of them. Some of them are just a finger prick. Some are an actual blood test that they just like regular blood draw for anything. That's what it is. The other test for COVID, when you're having symptoms, it's a little uncomfortable, but it's not painful. I wouldn't worry about it too much. It takes literally several seconds. Not even. It's just a swab in the nose. The nurse or the technician will insert like a Q-tip sort of into the nose a little bit further than normal, but it's not like excruciating pain for anything. It's just a little uncomfortable, but it's 3, 4, 5 seconds, 10 the most, and you're done.
Mm. Just thinking about it is like giving me chills. Like I don't know. To hear it, I can just imagine kind of what it's been like for the millions of people who have had to get tested and have been affected. So the next question is, when can a person who has or slash had COVID start interacting with people again?
Definitely the 14-day quarantine is at least a minimum. The other things to look for is are you still having symptoms? Are you still coughing? Is your fever still there? If any of those are present, definitely don't interact with anyone. Keep yourself quarantined. Your doctor may order the test, the swab test, to see if the virus has cleared from your body in a way. So if the test is negative, then you're probably okay. But always, if you have symptoms, then don't interact with anyone. If you're feeling super healthy, you feel like you're over it, you may want to check with your doctor to see if if the test is going to come back negative or not. But at least minimum 14 days of quarantine is absolutely necessary.
And I love this question. How has working through this crisis affected you as a doctor?
Great question. Initially, there had been a lot of stress when we first encountered the virus, when the pandemic was just beginning. There was a lot of uncertainty, there was a lot of anxiety. But I will say this, we found our own ways of coping with the stress of it all. And we really supported each other as a medical community. We've really come together, my colleagues, my physician colleagues, but also my nurses, technicians. We kind of, put our efforts together and supported each other. And the response from the community has also been wonderful. We really appreciate and are grateful for all the appreciation from you guys, meaning the community. We've had a lot of companies reach out to us, restaurants donating food, making sure we're well fed and things like that. We're extremely grateful for that. So we also, thanks to everybody's support, that has helped us carry through. And I will say this: I have been, writing about my experiences with the pandemic on the front line. So I know Shanique will put up a link later if anyone thinks and wants to see more of how this has changed me as a physician or affected me or whatnot. You can head over to my blog and see some of those reflections and journaling and some photographs as well.
Amazing. As if you don't do enough, like for anyone who might want to hear about that from Megan's point of view, I highly recommend to please go and do that. And even your Instagram is amazing. The photos that you take and your talents shine through there on top of being a doctor and putting your life at risk every single day. Thank you so much. I know I said this already, but I just need to express that again because I think it's extremely important. Thank you to everyone who joined us over the time that Megan was speaking. Hi, Clover. Robin said, is it compelling to hear how this affects? It is compelling to hear how this affects you directly as a doctor. You are on the front line of care, and your self-care along with community corporate care is vital. Thank you for that comment, Robin.
Absolutely.
And also, if people want to contact you, how can they do that? Can they contact you over your website?
Yes, there should be an email address on my blog if you guys want to reach to me directly on Instagram or Facebook. Please do. Instagram, probably I'm more on it than Facebook, to be very honest. I'm also on LinkedIn and on my blog, but probably Instagram is that's where because of my photography, I do spend a lot of time on Instagram. So if you message me there, I should 99% chance I will get your message and respond. And if anybody has any further questions, if I can be of any assistance, please let me know. I'm here for everyone. So
I saw earlier someone asked, do you hear the applause at 7 p.m. as they do in NYC? We know you're not in NYC, but how is it in Florida where you are?
There was, I don't think it was like that where I am. I know Miami, there was definitely times when they did the applause at 7 p.m. In my area, they did some different things. I remember one time we had fire department and police and everybody come and kind of pay tribute and just the gratitude, like people bringing free food has been wonderful. But I also have been able to experience the 7 p.m. applause because I have a lot of colleagues and friends who are doctors and nurses in New York City whom I miss very much.
Yes.
And my heart goes out to them because they truly, we've been hit, but not as bad as New York. And my heart, New York is always in my heart. And I know they had endured some really tough times. I know it's gotten better for them as well. So I'm super happy to hear that.
Yes.
They've been through a lot. But they did send me the videos of the 7 p.m. applause. So I loved hearing that.
I love that. I'm also curious, what has been both one of the best and one of the worst things about this entire pandemic, if you can share that with us? Like, do you have something that now that I wouldn't even say that it's slowing down, but do you have something that you are grateful for, something that is positive, something that you can share with us that you at least hold on to during those hard moments?
Absolutely. I do. One of the best things and, the silver lining of this whole experience has been how close it has brought me and some of my colleagues together. We were able to share a lot of our experiences. We reached out to each other. We made sure we're okay. Also, if we felt that someone didn't have PPE, we tried to kind of help each other get one.
Amazing.
I know some of my colleagues, like Sarah, the one you saw in the photograph earlier, she worked relentlessly to make sure we have everything, even above what the hospital provided. Just some things were obviously in short supply because of the pandemic. So we had to kind of be creative about getting it. But she made sure, okay, do you need this? Do you need that? We all kind of did that. We all supported each other. We made sure that we're wearing it properly. We made sure we reach out to each other on, when we're off and how things are going. So the best thing, I must say, even though the anxiety and the fears were very present in our lives, but having each other, being able to support each other, feeling close to others, knowing that we all go through this together. We're going through this together. We're not alone. Really made all the difference in the world.
I love that. Thank you so much. Tell us about your personal passion, your photography.
So I've been a photographer for a while now. I actually started photography when I was in med school. I always knew that, even as a physician, I can cultivate this artistic creativity. So I've been photographing. I travel a lot. You can see a map behind me. But when I travel, I take a lot of photographs. I've done some medical missions that I was able to photograph as well. And just recently, being able to kind of point my camera at the COVID pandemic has been a great creative outlet, something that has helped me cope and get through it, and also share with you guys and with everyone, what goes on behind the closed doors in a way, obviously with everyone's respect and privacy, but just to see, like even being able to take portraits of my coworkers and kind of highlight what they're doing has been wonderful. So,
That is so great. It's so necessary because this is such a I think this is a point in history that we will want to come back to, and we will eventually see some. I can't find the right word, but we will soon see some kind of positive, like, reach. Right now, everything seems a little negative with everything that's going on in the news these days and with COVID, but I feel like eventually everything is temporary. Every rainstorm has a rainbow at the end, and I truly believe that, whether we see it or not. So I believe that that is soon in the future for us.
And you have said it beautifully, Shanique. I completely agree with you, hon. Like, I think what you said is, I do also believe, I have high hopes. This is just, it's tragic. It's terrible. We've been through a lot as the world community, society. We've been through a lot, but I do believe this also will pass, especially if people are, keeping precautions and we do get a vaccine. But I also think you made a very important point. It is kind of a historical moment of our time. And one of the reasons I have been documenting it with my camera and my writing is because this is history in the making. And we need to have documentation of this. We need to leave it for future generations. Let's say 50 years from now, somebody's going to look back and be like, this is what they went through. This is what it looked like. The world in 50 years may look very different. So I think it's almost, a necessity for us to document what's going on. And that's kind of also been fueling the project, because I feel this is unprecedented times and we really need to remember them and also remember them accurately.
Agreed. I love that. Robin said we all cheer nightly for essential workers, and that's a great segue into reminding people to tune in to Recess this Friday at 4 p.m. on our Facebook page, right here where you are. We are going to have someone on who is going to work with children to make thank you cards for essential workers. I should actually try to see if we can send you one, Megan, because you deserve as well. We thank essential workers so much, and thank you so much to Megan. We have about 2 more minutes before we have to end, but thank you so much for being here with us and answering all of our questions. And again, if you have any questions for Megan after we are no longer live, you can reach her on Instagram at Megan Kwasniak, and it's right there on the screen for you all. So I really hope that you enjoyed this episode and that you will reach out to Megan on her website and on her Instagram and take a look at her blog entries and her writing and her experiences during this time and her photography as well. So thank you again so much, Megan.
Thank you so much for having me. It's been a pleasure.
Thank you. Bye, everyone.
Bye.